Every night we're talking to Boston's medical experts for insight into the coronavirus pandemic. We're joined now by Dr. Helen Boucher with Tufts Medical Center. Thank you for being with us again. Last week we talked about percent positive, the number of new positive cases every day versus those completed tests. Now yesterday, for the first time, we hit 10%. That seems to be the bar on considering relaxing social distancing. So what's the trend that we need to see from here?
Well, Emily, it's nice to be with you, and we hope to see a trend of that 10% number holding steady for 14 days as one of the measures that we use that it's safe to think about relaxing physical distancing and opening up.
That 10% number, does it have to be 10 and below, 11%? Is there any wiggle room there? How do we interpret the data?
Yeah, it's a great question, and I think there is wiggle room. I mean, there's a number of indicators that we're looking for. We're looking for downward trends in the number of new infections, for example, as well as this testing number. So we want to see it generally in this direction. We'd love to see it below 10% for 14 days, but I think the governor is going to be using all the data and all the information he can to make the decision about when it's safe to start opening up.
It's the context that matters. Speaking of that, so we're hearing from people in situations where maybe a spouse or roommate tests positive for COVID-19. Everybody quarantines in the household, but nobody else is getting tested beyond that one person. So are there concerns that we really do have a clear picture of how many people are infected?
Well, this is a very important question. So we know from what we've seen so far in other areas that household contacts are really one of the greatest risk groups of being infected with COVID-19. So it's very important that household contacts of people who become infected do quarantine immediately. We also hope to do more contact tracing, and that's part of the plan as we open up to institute a big, broad contact tracing effort so that contact tracers would talk to the infected person about who they've been with in the last several days, and then try to reach out to those individuals, not just the household contacts, but other contacts, to have them quarantine and then get tested as necessary so that we can contain infections related to that particular person.
But I think it's that as necessary piece. What do we need to do to be able to expand testing to those individuals? And what are the roadblocks to making that happen?
Well, to expand testing, we need to have greater testing capacity, and that's been a big focus in Massachusetts. And we actually, as of today or yesterday, are leading the country in the most tests per capita. So that's good news. We still have a ways to go to increase testing capacity and availability. And then we need to get guidance from our public health authorities and others about the ability to expand testing to people who don't have symptoms. And as we do that in conjunction with the contact tracing that we just talked about, we'll be able to kind of spread the circle around potentially infected people and then help prevent the spread of this virus.
So a lot of moving pieces in a lot of different places. Dr. Boucher, thank you so much for your time every week. We really appreciate it.